morning, everyone. My name is Jennifer Webb McCrae, and if you live in Cumberland County, I am your Cumberland County prosecutor. I'm happy to be back with you today. We're doing a series called Coping with COVID. And today we're going to be talking about services for mental health and drug abuse. And again, when I start this, our program, I always kind of explain, because I know people are asking, why is the prosecutor's office doing a series like this? Well, I have a firm belief that we should work across silos. And with respect to criminal justice, oftentimes issues that aren't addressed early on for what they are, such as, mental health issues, drug addiction issues being treated as medical issues, sometimes when they get out of hand, they find their way into the criminal justice system. And when that happens, we all pay a premium to address and deal with them. So I am a firm believer that we should work with our professionals in the addiction world as well as the mental health world to make sure that people get services much further up the pipeline. And if we do that, I think we can help the community make healthy, positive choices. And when we do that, we all win. So today I have with me Matt Rudd. He is a special agent in my office, and Matt helps me with strategic planning and some of these programs that we do. And I'm very excited to have Melissa Niles with us today. Melissa is the director of the Cumberland County Department of Human Services, and they do a lot in that department. So I'm going to turn it over to Melissa to tell you a little bit about who she is and what the Department of Human Services does for Cumberland County residents. Welcome, Melissa.
Thank you, Jennifer. Thank you for having me. And Matt, thank you for setting everything up. And thank you for that lovely introduction. Like you said, my name is Melissa Niles. I'm the Director of Human Services. I have been working in the field of substance abuse services for almost 17 years. And along that journey, I went to school. I have dual license. I'm a licensed clinical alcohol and drug abuse counselor, and I'm also a licensed professional counselor for mental health services. And through our department, we have several divisions, and we have the First Step Clinic, which is an outpatient, ambulatory, dual diagnosis, substance use disorder facility. We've been providing services since 1975. We have our Mental Health and Addictions Board. We have youth services. We have homeless services. We have the Municipal Alliances for Drug and Alcohol Prevention. We have Recovery on Wheels, one of my favorites. And, we have the hotline, Cumberland Cares. So I'm really glad to be here today to discuss what we're doing during this pandemic.
Yes. So for those of you that don't know, there's proof positive that organizations work across disciplines and are working to break down silos, because if you are familiar with some of the things that the prosecutor's office is doing, we contribute to the recovery effort by using some of the funds that we recover from drug dealers, forfeiture funds, to professionally train recovery coaches for our community. And that's one of the programs that we launched with Southwest Council and with the Department of Human Services. And I'm really happy to be a part of that. I'm happy to work with Melissa and her team with our Cumberland Cares program, as well as with the Recovery on Wheels program, which is suspended right now because we're dealing with the health pandemic. But both of us are working really hard to let the public know that if anyone needs help, the drug treatment programs are still in business. So, correct. Melissa, can you talk a little bit about the Cumberland Cares program and how people can access that during the pandemic?
Absolutely. So Cumberland Cares was initially, it's the brainchild of you, Jen, and your heart's desire. And I think your team initially came up with the Cumberland Cares acronym and the logo. And CARES stands for Compassionate Addiction Recovery Equals Success, which is
Yeah.
perfect because we strive to be strength-based in our approach to serving our constituents out there. They've been shamed enough. They've been beaten down enough. They've had doors closed on them enough. So Cumberland Cares is a strength-based approach where a trained recovery coach will answer the phone. It's 24 hours a day, and a trained recovery coach will answer the phone and help the caller, whatever the caller's needs are, whether it be if they're trying to access treatment or if they need support, or if they're already in recovery and they just need some encouragement to hang on and to keep the recovery going. That's what the Cumberland Cares hotline does. And it even though Recovery on Wheels, the actual outings are suspended for now, but we continue to serve through the hotline. And because treatment providers are still open, and we are able to assist people with warm handoffs.
Wonderful. And the number for Cumberland Cares, the 1-800 number, is 1-800-236-2448. We have cards that we try to give out to people when we are, out in the community. But we will also be posting a picture of the card on the comments for this video on Facebook. And hopefully we're trying to put it on our Instagram page as well. So if anyone needs a recovery coach during this time, it's 1-800-236-2448. And the card, what's interesting about it is when we started this project, we wanted people to know what a recovery coach does. And it says a recovery coach is a dedicated individual who removes obstacles and barriers to recovery from substance abuse. They partner with an individual to establish a trusting and healing partnership. He or she will motivate, encourage, and educate their peer through the recovery process. And I have to give a big shout out to you and your team because, having worked in the field of criminal justice for 25 years now, I'm dating myself, and starting my career as a public defender and somewhat of an informal case manager when I was trying to help my clients get into treatment. One of the barriers that we always faced was treatment on demand. It was really hard to get people treatment in a timely manner. And I feel like your team has kind of cut through those barriers. And all three of us can say we're witnesses to the fact that if someone wants to get into treatment, we are getting them in that day or the very next morning. Mm-hmm. So we are storytellers in our community to let them know that if you want treatment, we can get it for you. We're not saying it's easy, but because of your commitment, Melissa, you have really built a relationship with the treatment providers in our area and throughout the state and have tackled that issue. So kudos to you on that.
Well, thank you, Jennifer. And I have the same sentiments about you and your department. You are fabulous partners, and I love working with you. Thank you so much.
Melissa, could you talk about
everything we do? I love that. Thank you.
Yes.
Melissa, could you talk about that reality, right? So treatment on demand or treatment placement. We know that vulnerable populations are especially hit in things like a pandemic. So how is this affecting those who want to get help? What's this doing to the vulnerable populations that you're serving?
Well, so from what I've heard anecdotally and also through our First Step Clinic, even though we're having this pandemic and most outpatients are not doing face-to-face services, residential programs and detox facilities continue to admit people. So as long as people are aware, and that's, a big point of what we're doing right now is to get the information out there and to spread the awareness that people can still access services. As a matter of fact, there's more openings now than usual because people are not accessing, probably I'm being presumptive, but I assume that they probably believe that they won't be able to get in. So they need to make that call because those chances are that they'll be able to get in. And also in our community, our outpatient medication-assisted treatment providers, namely Pinnacle, they continue to be open, and they continue to accept new patients, and they do intakes 4 times a week. And I have that access phone number. I don't know if you want me to give it to you now, or I'll give it to you later and you post it. It's up to you.
You can say it now, and then you can give it to us, and we'll post it.
So the access number to Pinnacle, and that's for methadone, Subutex, and I believe Vivitrol. That's 856-839-2210. That's 856-839-2210. And also Maryville Detox and Short-Term Residential, they continue to serve. They also notified me this morning they have beds available right now, and there's 2 phone numbers to call. It's 856-629-0244. That's 856-629-0244, or 855-823-3428. That's 855-823-3428. So even though we're having this pandemic, people do still have access to services. And at First Step Clinic, what we're doing is we're doing telehealth, and we're still admitting people. We receive referrals, or even if it's a self-referral, we will, through telephone and video, conducting services that way.
So we have that number, and that's 856-451-3727, and we'll make sure we post that in the comments as well.
Okay,
but I think that's incredible, because in all of this, there's not like in a way that's almost unexpected. There is treatment openings and treatment availability that wasn't maybe as available before. And so you're actually saying it could be timely for people who want to get some help through treatment.
Absolutely.
And they could call those numbers. Could they also call First Step and get help through First Step to get placement, or the CARES number? Like, what's the best way to do that, or any of those?
I would suggest. Oh God, sorry about that.
That's okay.
It was my mom. Sorry about that. So the fastest way for person access, I would recommend call the Cumberland Cares hotline number first, because First Step Clinic is not in the building. We do check our voicemail throughout the day, all day long, but a person, a human being, is going to be on the other end of the Cumberland Cares line. So I would recommend that first, although they can get help either way.
Okay. So no wrong path.
I want to talk a little bit about this issue with the recovery community, and then this issue again with just the general community. So I see a lot on, when I'm going through Facebook and what have you, that we should be concerned about people who are in recovery already, because many, and me having family members that are in recovery, it's a lifelong, commitment, because addiction is a medical condition. And when I say disease, I don't mean in a negative connotation. I just mean it's a physical and medical issue that needs to be dealt with for your entire life. Absolutely. So even for our recovery community, if they're feeling isolated from other folks that have helped them maintain recovery, what kind of things should they be doing to stay in recovery, Melissa?
Well, so we embrace the concept of many pathways, which includes many ways for a person to access and maintain recovery. So for those people who embrace the classic, I'll just call it the 12-step philosophy, the Alcoholics Anonymous, Narcotics Anonymous, they have transitioned for now to online meetings through Zoom. Excuse me. So I will provide you with the information for the local, for Alcoholics Anonymous. I believe the website is aasj.org. That stands for Alcoholics Anonymous South Jersey.org. And they have links on there to join the virtual meetings. And for Cumberland, we're a consortium with Salem. So it's Cumberland Salem Service Area Committee of Narcotics Anonymous. So it's CSACNA.org, and it has the list of the virtual meetings. And also there is NJ Connect, which is, that one helps people who have substance use disorder and who are in recovery, as well as family and friends.
Oh,
So,
wonderful.
and that is a hotline where a person will answer a trained counselor will answer the phone and talk to the person. And NJ Connect, that's 855-652-3737. Again, that's 855-652-3737. And on their webpage, they have a bunch of links, and they have lots and lots and lots of virtual support meetings that are non-12 step, but they're still recovery oriented for family and friends.
Wonderful. So, and I don't know if my segue said it, but that was like mental health to stay in recovery. But, you know, we just have families in the community that, you know, I'm telling you, for me, it's not that it's a struggle, but, you know, my life has changed in a way that's different from what it used to be.
Right.
So what I'm experiencing is a little bit of insomnia, right? But
Right.
I also realize that the same social isolation that's helping us flatten the curve might be triggering depression and other type of mental health issues for people who maybe live alone or are like forced to, you know, be cooped up in the house with all those stressors. So are there services or help for people who are just struggling with, you know, depression, mental health issues, possibly, you know, aggression with DV issues? That's something we're looking for in the community.
Yes. So for the mental health services, we are referring people to mental health. It's called NJ Cares, and that is they have online services, and I believe we have it's the Mental Health Association of New Jersey, and Matt has that listed here. It's www.
Oh, I apologize.
Oh, no, that's fine. But that's a really great resource, and they do wonderful work. I don't know if you remember the mental health players that we did last year. They are affiliated with that. They are very versatile, and just, you know, I want the public to know that calling these phone numbers it's not a weakness, and it does not even mean that a person has to have a mental health diagnosis. We need support, like you said. You know, we're used to being living our lives a certain way, being productive, going out of the house, going to work, etc. Being home for long periods of time, it can trigger, you know, thoughts of loneliness. And for people who are in recovery from substance use disorders, if they're home alone in their head by themselves for a long period of time, that's not good. And I don't know if you know this or not, but like if there is prescription drugs in the cabinet or alcohol in the refrigerator, those pills start to talk. And the alcohol talks, and in other words, the person starts to have thoughts of using, they get cravings and urges. And one of the most effective ways to fight off the craving is to talk about it with another person who understands. So
that's good.
Yeah, it's a good resource. But people don't have to have mental health diagnosis, or they don't have to have their world crashing around them to reach out. And sometimes it's just, I know that like yesterday I went to the grocery store. I hadn't been out in a week. Just the fact of being around people. I had the opportunity to give a gentleman who was lost, I gave him directions to the Garden State Parkway. That just gave me such joy because I got to interact with another human being. And, you know, that helped my day. So that's another reason the importance of these hotlines and virtual resources is to stay connected, because human beings were meant to connect. We're not meant to be in isolation.
Right.
Yeah.
How about like the homeless population or youth services? Are there still services for those folks, you know, in their vulnerabilities as well?
Yes. So I'm glad you brought that up. So, you know, the homeless have a new challenge. They already have a lot of challenges, but one of the things we've noticed is because the library, public places are closed down, restaurants, fast food restaurants, they're takeout only or drive-through. The homeless don't have a place to charge their phones. They don't have a place to wash up. because the reality is a lot of time that's where they go. They'll stop into like a church that's open for a self-help meeting. So they have those extra challenges now. And so it's really difficult time for them. And our family shelter has been on moratorium since the end of March from orders from the Violent Health Department. But even though there's moratorium, the good news is that the state of New Jersey had recently initiated 211 to be the place to call after hours across the state, after hours on the weekends for hotel motel placements. And so currently, if someone is homeless, all they have to do is call 211. Now the wait time, I'm going to be honest, I've heard that the wait time is a little bit long, but just I want to encourage people to hang in there. They will be served. They might have to hang on hold for a little bit, but they will be placed. They'll be screened and hopefully placed in a hotel motel at no charge.
So now what's the number for 211? Is it literally 211?
It's 211. It's the same 211 that we've had for years. That's basic resource for info. But 211 has been designated as the overseer of after hours and weekend placements for the homeless.
Okay.
And they are placing people in hotels.
What should people do during business hours? Who should they be calling?
Well, they can call our department. They can still call 211 during.
Okay.
They can call anytime, but it's they can call us during the day, but really what's going to happen is they're going to be screened. So, and they're probably going to be referred to 211 if they're homeless and in need of immediate shelter, because currently our shelter that we would refer people to is not accepting people. So it's more expeditious for people to call 211 directly, but they can call us.
Okay. So, one issue that I think comes up during this time that we'd have to address and deal with. What if a family or someone is living with someone who is in addiction and they're not acknowledging that they are? I would imagine that during this time where like people can't leave out of the house and stuff, it just kind of magnifies some of the issues that people have. What should a family member or a loved one do if they're like living in a home with someone who's struggling with addiction and is not making the acknowledgement that they are?
Well, it depends on there's many pathways to approach that as well. It depends on what a person's beliefs are, because, there's some schools of thought that say, family members would fare best if they focus, instead of obsessing over what the other person's doing, work on themselves. However, that doesn't work for everybody, because some people don't want to do the so-called tough love thing and kick their loved one out because they couldn't live with themselves if something happened to them. And we don't want to make people feel guilty for doing things like that. So there's something called the CRAFT model, which is it's an evidence-based model that's also offered online through the Mental Health Association of New Jersey.
Can you spell that model?
It's CRAF. And I forget what the acronym stands for, but it's a strength-based model, and it's like one of the first links when you go onto their website. Excuse me. And it's a structured program of suggestions for families that give them productive interventions to do. It's not nagging, it's not threatening, but it's constructive ways to motivate their loved ones into getting help and, setting boundaries and such. So it's not the extreme of, I can't do anything, I'm just going to focus on myself. You have to hit rock bottom. So we've learned that we can raise people's bottoms, because, in this day and age where the stakes are very high, people lose their lives. So there are things that family members can do. So that's a really good question. I'm glad you asked. I also just want to circle back, because Matt had also asked about youth services. We are continuing to serve youth. We're continuing to do telehealth with them for our adolescent program at First Step, and also our shelter beds. They are still open, so but they're not accepting new placements, but they're also not discharging youth at this time, because they want to make sure that they have a safe place to be. And also all of our in-home programs, whether if it's through our YSAC or through the state children's system of care, they all continue to operate just through telehealth.
Okay. And we have been sharing some of that information because we are the things that, we worry about in this time period with the social isolation as it relates to criminal justice is DV going to go up? Domestic violence going to go up? Is child abuse going to go up? Because the systems that normally are checks and balances to that, like the schools, like our church family that we see when we're going out week to week, we're not seeing, we're not having them work because we're not doing those things right now. So we've had a couple videos on some ways to cope with the stress that might occur in the home, and we'll continue to share information about those things.
Right.
So Matt, do you have anything else that you want to ask before we wrap up?
I don't think so. I love this conversation, right? Because in kind of recapping some of the things I heard, there are so many resources that are available. In fact, there may even be more resources available now than there were in very recent past. And also, that continued encouragement to check in on each other, right? That social interaction, we can still be socially connected, even though we're distant and it's not as rich in terms of interaction. For sure, we can be checking on those that we care about and being supportive. So great content.
Right. Hey, Matt, I wanted to make sure I emailed you earlier the food pantry resources. Did you receive that?
I did.
Because
in
there
the
are
email.
several. Because even though go ahead.
Melissa, I don't know if you saw the resources. I got a list from the state and I had posted it. There were like a number. I was surprised at how many food pantry or organizations that help with food are in our area.
We have several.
Yes. So I will share that again on our Facebook page as well.
Thank you.
So that everybody's aware of how many food pantries are really working hard to make sure people remain fed.
Right. And some Help and Hope Ministries, which is one that our department does fund partially, they will deliver if people don't have the means.
Okay.
Yeah.
That's great for our seniors in particular.
Exactly.
Yeah.
By the way, also for transportation, even though our Human Services Advisory Council vendor is not providing transportation through our department of the Office of Aging, they continue to provide transportation through CATS. So, and it's, they also, people, and I don't want to speak on Barbara's behalf, but I want people to know that CATS still operates and you don't have to have a disability or be a veteran to be able to ride.
Oh, wow.
So
I thought it was for seniors and disabled people, but that's interesting to know.
Correct, because if you need to get to the grocery store, they will pick you up and take you.
Okay. All right. So I will try to find some information about the CATS program, and we'll try to post that as well.
Okay.
So we really thank you, Melissa, for taking the time to talk to us. We're really lucky here in Cumberland County to have someone, number one, with your expertise and your experience in your field. I would venture to say that you're a subject matter expert in the field of, mental health and addiction. And we're really lucky to have someone who has your passion and heart for people. So we appreciate you and want you to know that, and want you to know that the prosecutor's office supports these efforts.
Thank you.
We feel it's a solution in solving our crime problem.
Thank you. I really appreciate that.
Yes. So that's Coping with COVID. Services for Mental Health and Drug Abuse. Thank you. We'll be coming back. Stay tuned. We're going to be doing an episode with some dynamic recovery coaches. And thank you to you, Melissa, for allowing them to speak with us.
No problem. My pleasure.
Thank you. Take care.
Thanks.
You too.
Bye-bye.
Bye-bye.